Okay, so welcome everyone to our Eating Disorders webinar. Today we've got Dr. Kim Sundling from Florida Blues Behavioral Health Team. She's a board-certified psychiatric pharmacist with direct and indirect clinical experience, and she's our clinical pharmacist at Florida Blues for both commercial and Medicare members. Kim, I'm going to turn the microphone over to you.
All right, thank you so much, Patty, and welcome everyone. I appreciate you being on this webinar today for a really important topic. I am really excited for you to learn more about eating disorders. They are often one of the more misunderstood mental illnesses that are out there, along with substance use disorders, which if you were on the webinar last month, you got to learn about that. And now we're going to be talking about eating disorders. Now, if you've been on a presentation with me and likely Debbie before, one of the things we always like to start these presentations off by is saying that we will not be answering any direct, specific cases. So if you yourself or your child is suffering from an eating disorders, I will not be answering specific case questions, just because I am not your doctor, and you should have that conversation with your doctor because they are most familiar with your case or whoever's case you are asking about. So if you do ask a question like that and your question is not answered in the live Q&A, that is why. So I just want to put that little disclaimer out there, but I am looking forward to going over and having this conversation about eating disorders. So you can see on the screen, this is what we're going to go over today. I'm not going to read word for word what's on the screen, but essentially we're going to go over the different eating disorders, explore some of the facts about eating disorders, common myths, statistics, and then what we all probably care about being at this webinar is how do you support someone with an eating disorder, or what help is available. So we should be able to answer all of those questions at the end, and let's get started. And one thing before we get into the nitty-gritty of what eating disorders are, something that we at Florida Blue really care about and want people to understand are going to be on this slide and then the next slide. Now, a couple decades ago, or even a few years ago, we in the medical field often thought, or some people still think, that physical and mental health are separate. So you can see here on the screen, meaning the body and the mind are separate. But really, there is no health without mental health. We say that all the time, but in reality, what that means is if one part of your body, meaning your mind or your physical body, is not working, the flip side is likely not to be working either. So if you have anxiety and your anxiety is uncontrolled and you also have asthma, your asthma is likely not going to be controlled unless we're focusing on both of those aspects. So it's important to us to realize and treat someone as a whole person. And that's essentially what this picture is explaining. The other thing at Florida Blue that we really care about is mental well-being. And this is going to really vary depending on which stage of life you are, which you can see on the screen. We have a youth definition. We also have an adult definition. And with that being said, I'm assuming most people on this call are adults, so I'm going to focus on the adult one first. With mental well-being, this can really vary week to week, sometimes even day to day, but it's good to have a definition so that we can understand what we are feeling and also understand where we are at in life. And what mental well-being is, it's an overall positive and hopeful emotional state fueled by a sense of purpose, satisfaction with life, work, and relationships, and supported by the capacity to adapt to life stressors. So how well can you handle the day-to-day stressors is really going to show you how good your mental well-being is. I'll leave the youth definition there for you to read, and it's something to maybe ponder about how your kids or nieces and nephews are doing, and just the youth in your life. So that is something we really care about. It's something we really strive for. And as we go through this presentation, if you have someone with that's suffering from an eating disorder, or you yourself are questioning if you are, or maybe you know you are, hopefully you can have a better understanding of how you can help your mental well-being with this presentation. So eating disorders, what exactly are there? There are so many misconceptions about eating disorders out there. Some people think it's just dieting. Some people think it's a choice. They just want to lose weight and things like that. And in reality, it's none of those things. Eating disorders are extremely complicated. Every case is different, but the definition of eating disorders is a group of behavioral health conditions categorized by severe persistent disturbances in eating behaviors and are associated with distressing thoughts and emotions. And these often co-occur with other psychiatric conditions. And I would say, and this is not a fact, but I would say in probably 90% or even higher of the cases, there's always an underlying psychiatric condition such as depression, anxiety, and OCD are definitely the more common ones. So they often start from that psychiatric condition, and I'll go into way more detail on that in a couple slides here, but that can often be the trigger for the eating disorder to develop. And really the treatment of an eating disorder, you really have to make sure that you're targeting that depression and anxiety, OCD, or whatever the mental health condition is in order for that person to truly recover and be on their way. So you can get a sense from that eating disorders are not just about food. They are extremely distressing. They're a very serious condition, and I'll explain why here in a few slides. But that's just to give you a sense of what eating disorders are. So how common are eating disorders? I'm assuming most of you on this call have had experience, or maybe you yourself have a history of an eating disorder, or you have a child that has an eating disorder. So let's go over some statistics. And the one that I really would like you to focus on is that left top box. Or at least it's left on my screen. I hope it's left on your screen. But there is such a misconception that eating disorders are, you can just choose to have an eating disorder. It's just about weight loss and all these things. But this statistic should really show you how serious these can be. Anorexia has the highest mortality rate out of any of the psychiatric disorders. That is a very startling statistic to me. And you'll understand why there's a high mortality rate here at the end of the presentation. But just some of the other ones, 22% of children and adolescents worldwide have shown disordered eating. At age 6 to 10, girls start to worry about their weight. And by 14, 60 to 70% are trying to lose weight. Think about how young that is, that they're already trying to lose weight. I can think back to when I was in high school and I had those thoughts. And it's becoming younger and younger in the population. 8.6% of females and 5% of males will have an eating disorder in their lifetime. Yes, eating disorders are more common in the female population. However, males are less likely to go and get help related to stigma and a wide variety of things, but there is not a large male presence in the eating disorder statistics here. I have a feeling it's higher. I don't think it's more than the females, but I think it's underrepresented in that statistic. 9% of the US population will have an eating disorder in their lifetime. So not as common as, let's say, anorexia, or not as common as anxiety or depression or something like that, but it is fairly common. And if you have come across someone, you will definitely understand that. And then just one other important stat that I want to talk about today is that in the BIPOC, people, they are affected by eating disorders at similar rates. However, they are about half as likely to be diagnosed. And in July, we will go over some more of those statistics related to other mental health disorders. But it unfortunately seems to be a trend in that population. So those are some interesting eating disorder statistics. Hopefully it will show you a little bit about what we're dealing with, some of the severity, since anorexia is one of the highest mortality, or has the highest mortality rate. So let's go into what that is. these are going to be the more common eating disorders, or ones that you have likely heard of before. There are other eating disorders out there. They're not as common, and I'm happy to answer any of questions regarding those. But for the sake of the conversation today, I wanted to go over the most common ones that you have likely encountered or heard of, or have a friend or a child, so on and so forth, that may be experiencing this. Now, the most common, and probably the one that most people are familiar with or have a sense of what it is anorexia nervosa. That is the full name. It's often referred to as just anorexia. But again, remember, this is the one that has the highest mortality rate. These characteristics are based out of the DSM-5-TR, which is our diagnostic manual that we use in the psych world. And this is some of the characteristics. There are more characteristics, but these are the ones that I think of when I think of these three disorders. So anorexia, they often lose more weight than is considered healthy. They typically avoid or severely restrict food, and they may have an intense fear of weight gain. So you can kind of start to think about why that might be problematic, right? Like, our bodies need fuel, aka food, in order to function. And as you lose weight, your body starts to get nutrition from itself. So there's muscle wasting, and it doesn't limit itself to the muscles. It can go to organs, your heart. All of these things are affected if you have anorexia, especially depending on the severity of this illness. Now, bulimia is pretty similar to anorexia. However, what makes bulimia unique to bulimia is that individuals will often go on what's called a binge, consuming a large amount of food and then purging it or doing something to prevent that weight gain. Most commonly, it's self-induced vomiting. It can be abusing laxatives to expel things through the GI tract. There's also excessive exercise, which I do not have on here. But again, it is a way to prevent that weight gain. And these individuals, just like the next binge eating disorder, have a loss of control surrounding food. These people will just intake food, and they are in that moment. And then after the episode is done, it's like, holy cow, what happened? I don't ever want to do that again. But yet they keep finding themselves doing that again and again. And with bulimia, you can probably guess some of the medical complications related to bulimia, especially if you're inducing vomiting again and again and you have stomach acid rubbing up on your esophagus, the back, there's teeth decay. You can even burn a hole in your stomach sometimes. There's a lot of things that go with bulimia. But the interesting thing about bulimia is a lot of these individuals, they are trying to prevent weight gain. However, the methods that they're using, it doesn't get everything out of the body. So sometimes when someone is bulimic, they actually gain weight or they are a normal weight, whereas with anorexia, and I'm sure all of you are aware of this, they tend to be very skinny, sometimes even skeletal, but you don't have to be that skeletal necessarily to have anorexia, but those are just a little bit of the differences between the two. And then the last column there that I'm going to go over is binge eating disorder. And this is similar to bulimia in the fact that they have episodes of binging, meaning they consume a large amount of food in a short amount of time, but they do not do the self-induced methods of preventing that weight gain. So they don't typically, purge, they don't abuse laxatives and things like that. But again, like bulimia, there's this lack of, or this sense of no control around those types of behaviors. So with that intake of food and then, just letting the food sit, binge eating disorder, they typically gain weight or they are obese in a lot of cases. So there's a wide range of bodies and things like that. But I want to make it very clear that all of these do not have a size. You can have this disease and be completely skinny and have binge eating disorder, or you can have binge eating disorder and be overweight. It just really depends case to case. But all of these things usually are stemming from a sense of need for control or something like that. It's never just about, I want to lose weight or anything like that. It could be a college student going to college for the first time and having an extremely stressful experience and just wanting to control one piece of their life, and that one piece is what they put into their mouth. Or it could be the young girl that unfortunately experienced sexual trauma, and she's afraid of everything around her, and food is the only comfort, and that's what she uses to comfort herself. Binge eating disorder often stems from sexual trauma or just trauma in general. So it's a way to control one aspect of your life. So these are not just food. I hope that's pretty clear. It's very complicated. There's strong emotions involved. There's anxiety, there's guilt, there's shame, and they often are very lonely because a lot of these people that have these, especially like with bulimia or binge eating disorder, are doing these binges in private and by themselves. So those are some of the common types out there. And then the other ones, like I said, I'm not going to cover them, but there's a whole bunch of other ones out there, but these are the more common. So let's talk about why this happens. Why do eating disorders happen? And I want this to be very clear to everyone on the call that there is not one particular cause. And this is really important, especially if you yourself have a history of an eating disorder and your child suddenly develops it, okay? There's a lot of factors that go into this. So I'm going to go over these, and just keep in mind that just because someone has all of these potential factors or things like that, it doesn't mean that they're going to have an eating disorder. Someone could have none of these things and have an eating disorder. But what this means is that if you have these characteristics or someone has these characteristics, they are more likely to have an eating disorder because they just are at higher risk. So biological, meaning these are just the things that are. They're what we inherit. So things like having a first-degree relative with an eating disorder. So if a mom or a dad has had anorexia, their child is more likely to have an eating disorder. It doesn't have to be anorexia. They are just in general more likely to have it because it's genetic predisposition. Type 1 diabetes. That is very, very interesting. Type 1 diabetes, unfortunately, there are some people that have type 1 diabetes that abuse their insulin, and that could be a whole nother webinar. But just know type 1 diabetes can increase the risk, especially in the teenage population. If you have a history of dieting, that makes you higher risk for that. So psychologically, what's going on up here? Perfectionism, being impulsive. That impulsivity comes in because binge episodes tend to be really impulsive. Like all of a sudden you can be in the car on your way to McDonald's and you don't know how that happened. It's very similar to cravings that someone may feel in a substance use disorder, which you heard about last month. Another big risk factor is just having a mental health disorder or a substance use disorder in general just increases your risk. And then having body dissatisfaction. Like if you are just look at your body and you're disgusted, that also increases your risk of having an eating disorder. Social, what's around you, if you're being teased, weight stigma, are you going to the doctor and every single time you go there, you're talking about something that's going on and your doctor is just telling you that you need to lose weight and they aren't listening? That's weight stigma. And do you have limited social networks, meaning you don't have a lot of friends in your life? Past experience about trauma, I talked about that. And then just having a family overly focused on dieting. So mom is counting macros extensively, weighing her food and all this stuff, and the daughter sees that, or the son sees that, and they think that's how they have to have a relationship with food. It's just going to increase their risk of having an eating disorder because they're trying to mimic the person that they're watching. Now, again, that doesn't mean because if you are dieting around your child, it doesn't mean that your child's going to have an eating disorder. Because of that, there's lots of other factors involved, but just know that that could impact, especially if your child or whoever has these other risk factors. Female gender is going to make someone higher risk. That's unfortunate. The females just tend to have this more. Age is pretty self-explanatory. You can probably guess which age that is, but the teens and then early college is typically when females develop this, and males as well, but it's more often females. Sports, certain sports like being a gymnast, being a ballerina, just dance in general, cheerleader. I was a gymnast growing up, and my coach had made comments about how if you were a smaller size, I could flip around easier. So it happens. I myself have experienced it. It still goes on today. If you watch the Olympics, a lot of Olympians are very open about that, especially in the gymnastics world. So it happens, unfortunately. Other things, being overweight, and then sudden stressful changes. I gave the example earlier, but I think it's a great example, is going from like high school to college, or parents being divorced, things like that. A big stressful change in your life, or losing your job, something like that, could be the trigger because you want to control something in your life. Warning signs. So we know what causes them, we know what they are, but how do we know someone is experiencing an eating disorder? And there are a lot of warning signs, and you'll notice on this slide that I do not have them like anorexia, these are the warning signs, binge eating disorder, these are the warning signs. Really, all of these can be applied to pretty much all of the eating disorders out there, but some of them are going to be a little bit more evident, the one that I'm talking about. So let's talk about behavioral. And I'm going to, in this kind of example, I'm just going to talk about a teenage female daughter, okay? So you come home from work, you're cooking your supper, and all of a sudden your teenager's like, I am not eating dairy anymore, and there's nothing against being vegetarian or veganism, but if someone comes home and they're like, I'm going to be vegan now, just out of the blue, that can be a potential alarm. It doesn't mean that they have one, it's just something to think about. If they're doing extreme changes from what their normal is. Evidence of binge eating. Are you finding candy wrappers in your daughter's room? Is there, does it smell like vomit in the bathroom? Is there things in the vehicle? Social withdrawal. Are they no longer hanging out with their friend group? Changes in food preferences. I kind of already talked about that. Avoidance of eating meals. I'm going to eat in my room. I don't want to eat at the table. Oh, I already ate. I ate at my friend Jessica's house. Things like that, especially if they don't normally do that. Lying about the amount or type of food. This can be either or. So it could be having more food than normal, or it could be, just skipping meals and things like that. So those are behavioral. Physical. These may or may not be present. Sometimes when we catch eating disorders early, these are not going on. It's typically the behavioral or the psychological first. It has to be pretty severe for some of these things to show up. So I just want to make that clear. If you have any inkling of that going on, they may not have the physical component yet. Weight fluctuations. Now, this can be either or. It could be extreme weight loss, or it could be extreme weight gain. But the fact is that it's not a healthy weight gain or weight loss in either way. It's not a medically safe way on either regard. Sensitivity to cold. I live in Minnesota, but we're going to use the example of a teenager living in Florida. Is it 95 degrees out and your daughter is out in sweatpants and a hoodie outside in the middle of the day and they're still cold? That should be a red flag. Swelling around the cheeks and jaw, this is going to be a bulimia sign. You have a parotid gland, parathyroid gland here, and it basically, when you vomit, it causes you to have saliva, and it's released from here, so it can almost be like a moon face and have really big facial swelling, especially right after purging. Hair loss, this is really mainly anorexia, bulimia, weakness, dizziness. That should be pretty self-explanatory. And then psychological, we pretty much touched on these, but distorted body image is your daughter now suddenly saying, oh, I'm fat, I need to be this size, I need to be this weight. that's concerning. Preoccupation with food or your body. Again, same thing. Are they depressed, angry? Are they irritable? Especially if they're irritable, this can be a really big sign in anorexia because they just aren't getting the food that their body needs, along with bulimia post-purge as well. And heightened anxiety around meal times. That's the last one I wanted to talk about. So is your daughter getting extreme anxiety if you have to go out to eat and she's having to eat in front of you again, and she's been making excuses? Is she just pushing her food around on the plate? One that I don't have on here that I just want to mention before I go to the next slide is after your daughter, again, we're using daughter in this example, is your daughter going to the restroom immediately after eating every single time? How long are they in the bathroom? Does it smell like air freshener? Does it smell like vomit? Those types of things are, again, signs that it's likely bulimia, purging. But again, just if all of these are taking into account all of these things, we should have concerns about a possible eating disorder. And again, this list is not all inclusive, but these sometimes or most of the time are going to be present, but just things to look out for. So eating disorder facts, I think I've talked about all of these already, but these in the flip side are often missed. So let's talk about facts. So eating disorders are serious. I think we covered that in detail. Anorexia has one of the highest mortality. They can cause a ton of physical complications, psychological complications, and things like that. Eating disorders are not just about food. They are often someone screaming for help. They're anxious, they're depressed, and this is their way to control it. They do not have a body size, race, or gender. Anyone can get an eating disorder, especially if you have certain risk factors like I talked about. They are not caused by one factor alone, and I think that's important to remember. They are not a choice, so the treatment is simply just start eating meals and don't go to the bathroom after, or just eat food and then you'll gain weight. It's way more complicated than that. I'm going to go into treatment, I believe, on the next slide, but just know that it's not a choice. It's much more complicated. But good news is that they are treatable. We have a ton of evidence to support the treatment of eating disorders, and let's get into that now. So recovery is possible. And this quote by Brittany just really hit the nail on the head here. But no two eating disorders are the same. No two individuals are the same. But no two paths to recovery are the same, but everyone's strength to reach recovery is the same. So you could have someone that presents with minimal signs or symptoms of what I was talking about earlier. And on the flip side, you could have someone that has all of those things and is on the severe part of the scale. And all of them are showing amazing strength and courage to recover, because recovering from an eating disorder is incredibly difficult. And I think it's just important to remember that no person is the same, but that strength and courage that it takes to get help is incredible. So treatment. I'm not going to go into super in-depth just because that's not the purpose of this webinar. And on the next slide, I'm going to talk about how you can support someone that is maybe struggling with an eating disorder, which I think will be of interest to many of you on the call today. But like the previous slide said, any treatment plan needs to be tailored to that individual person. No person is going to have an identical treatment plan. That's just not how it works, especially in the psych world. The treatment usually requires the support of licensed professionals along with loved ones, so parents, spouse, friends, siblings, things like that is really important for the person that's in recovery. And it pretty much always requires a multidisciplinary treatment team. And on that team is typically a dietitian, a nurse, a psychiatrist, a medical doctor, meaning someone like a PCP that's specialized in internal medicine. Given all of the medical complications, especially from anorexia, we have to monitor those very closely. And then one of the most important, they're all important, but one of the really big pieces of treatment is going to be with a therapist and exploring why the individual is doing those things to help treat that and hopefully help prevent that like binge episode happening from again, understanding what that person is, why that person is doing that and what it's stemming from. And treatment location really can depend case to case. Again, you can do inpatient, there's outpatient, there's things like partial hospitalization, things like that, intensive outpatient programming. Inpatient is typically for someone that is just not medically stable. And what comes to mind for me for that is someone that is has severe anorexia and they just are not safe to be at home yet because they are so medically decompensated from not having food. And we often have to refeed someone with anorexia at a very slow pace because it can cause harm. You can't just have someone with anorexia go and, go hog wild at a buffet or something like that because it's ultimately really going to throw their body off and cause more harm in the meantime. So the location's really going to depend on the severity of the illness. So how do we support someone? The most important thing that I personally feel that you can do is just showing that person that you are there to help them. Stating how much you care, whether it's through verbal explanation or helping them, go to their appointment, help them with their laundry, things like that. And you want to avoid putting the pressure on them or you want to avoid trying to control the person. I know it's really tempting, but it's ultimately not going to help them because they ultimately have to decide that they want to get better. And it's really hard with the child, especially in a teenager that brain's not fully developed and there's just a lot of emotions as well. That can be really hard. The second one is do not urge them to eat or not to eat unless it's a part of their treatment plan. And the not to eat is talking specifically about binge eating disorder, but it's never going to work for you just to tell them to eat. It's like telling someone that has depression to just be happy. That's not how this works, unfortunately. I mean, it would be much easier if that were the case, but again, this is something that is very difficult, especially because you may be in a position where you do not understand why they just won't eat, especially with anorexia and they are extremely skinny. That can be really hard. Avoid comparisons with other people. So meaning, have you had another person in your life not or recover from anorexia or recover from bulimia? Do not bring them up. That's not helpful in this situation unless maybe you yourself had. That may be okay, but again, just try to be careful with that. Listen to them. Talk them through their feelings. What are they feeling when they have the urge to binge? Tell me about it. Try not to control their behavior. And that one's especially hard, especially like in bulimia. I've seen parents like lock the bathroom and things like that. And that is an incredibly stressful situation for that teenager or child. So those are things that you would want to talk about with your treatment team for your child. Try to remember the big picture. What's the goal? What do you want out of this treatment? Try to avoid guilt and self-blame. And this one is talking in particular about people that maybe dieted in front of the child, or you yourself had an eating disorder and now your child has an eating disorder. So it's not only, that is not the only factor in why that person might have an eating disorder. It's much more complicated, and I think I made that pretty clear. And again, that one is very difficult not to fall into, but try to remember that it's not your fault. And then lastly, this is, I think, one of the more important things, is to consider personal counseling And then even family counseling, because if you have other children in the home and all your focus is on the one child because they're sick, you may be leaving, not intentionally, but the other child may be feeling left out. And they may feel that they have to be that way for you to focus on them. So in order for them to understand their feelings, their big feelings, you might want to consider family counseling or even just individual counseling for your child that is maybe not suffering from an eating disorder. So these are some of the things you can do with someone or how to support someone. There's more out there, and some of the resources that I'm going to show you here soon, those are great. They have great resources on how to support someone, but also really lean on the psychiatrist or the therapist, things like that. They likely will have great advice as well. And I can answer, if you have any questions on the supporting aspect, I'm happy to answer any of those. So these are the resources. There's a lot of them on there. The one that I really want to point out is NEDA. That is the National Eating Disorder Association website. It's where I got a lot of my information for this presentation. It's only eating disorders. So pretty much if you have a question, you're going to find the answer there. And then lastly, Florida Blues Care Partner Lucette, their website has a lot of good information as well, along with the other websites that I have listed here. Oops, went too far. And I just want to end with this quote, and then we'll go into questions. This is probably the most powerful thing I've ever read in terms of eating disorders, but and I said to my body softly, I want to be your friend. It took a long breath and replied, I have been waiting my whole life for this. So just kind of let that soak in, and I will take any questions at this time.
Okay. Go to the questions. Okay, so the first question, it kind of came as you were talking about some of the signs and symptoms. Can you discuss sleep eating or excessive eating at night?
Well, so sleep eating isn't necessarily an eating disorder. Excessive eating can be related to binge eating. I guess I might need a little bit more information on what exactly you're asking. But binge eating disorder often is done in times where someone is by themselves and it's, intaking a bunch of food, and it can be at night because that's the time that the person's home from work or they're by themselves or they're in the privacy of their bedroom. But like just eating in your sleep, that's not an eating disorder. That's actually a sleep disorder.
Okay. Can you explain more what the cravings are like with an eating disorder?
Yes, that's a great question. So with eating disorders, it's really going to depend on the eating disorder, but I'm going to focus primarily on bulimia and binge eating disorder, what that craving is in terms of wanting to binge. So it often involves having a stressful event. So it could be, you break up with your boyfriend or you flunk your test and that's just not good for your GPA, right? And you just you don't know what to do. You feel beside yourself. And the only thing you can think to do is to go and binge. And if you have bulimia, you purge. So it's like this overwhelming feeling of just needing to do something for yourself. And it, unfortunately, is typically binging. So that's really the only way I can crave it. It's kind of similar to if you, the only way I can really describe it in terms of how strong it is if you really have to go to the bathroom and you need to go to the bathroom, that's how that feeling is. It's like you just have to do it. And then when you do it, you feel better, unfortunately. And that's why it can be, in a way, addicting. So.
Okay. The next question came in and said, I'm really curious about avoidant restrictive food intake disorder and how this is approached by the medical field and the psychiatric field, especially how it's treated, as it seems the cause manifests differently than typical eating disorders.
Yes, and this is not one that I covered. So thank you for asking this. ARSD, ID, is typically, it's often in autism, individuals that struggle with autism, and certain foods just cause extreme anxiety. They just, whether it's, just like it doesn't taste good, or the texture, it's typically texture. Treatment is actually pretty similar, and that might be surprising, but I would say your best bet for someone that has that particular disorder is to see someone that's specialized in eating disorders, because and I can only describe it as really exposure therapy. You just expose yourself to the different foods, and it's done in a safe environment, just like we would treat PTSD. So I would definitely see an eating disorder specialist.
Okay. Is there a certifying agency or credential for therapists that specialize in eating disorders?
So I don't believe there's an agency, but I can take that back myself. But credentialing, it's more, there's specific training you can do, just like I'm a board certified psychiatric pharmacist. I had to take a special test and all that. I have to do particular CE. So you definitely have to be, you can be specialized in eating disorders, and there's specific training you go through, because if you have, depending on the level of severity of your eating disorder, you should definitely be being seen by a specialist, like someone specialized in eating disorders, just because I don't want to, it sounds terrible, but like a normal psychiatrist or a normal therapist may not have the skills to help you the most.
Okay. If some of this information resonates with me, what should be my first steps? How do you begin to address the issue?
Well, first I want to say I'm so proud of you for taking this information in and realizing, maybe there's something going on here that maybe isn't okay. And that's huge. That's honestly the first step, is admitting, like, maybe I do need help. And depending on what you have going on, really your best bet is to see your primary care provider or your family doctor, things like that, because they can listen to you, and they can also assess you medically. And then they will likely make recommendations on seeing someone in the mental health department, and depending on the severity, they may just send you straight to an eating disorder specialist. But I would start with your family doctor to make sure medically everything checks out. But again, that first step is what you did, so congratulations.
Okay. Next question is, how does body dysmorphia fit into this?
Yes, I was wondering if this question was going to come up. So body dysmorphia, if you're not familiar with it, it can be a wide variety of things, and it's kind of the scales are different depending on the person. It can be, just this extreme unsatisfaction with the way your nose looks, or the way your body looks. And some people will get plastic surgery to fix that, and that can be body dysmorphia. Or they'll do extreme dieting in order to be super skinny. But that, just because they're dieting, that doesn't mean they have anorexia, right? So it definitely fits into it. It's a huge risk factor. A lot of people that have body dysmorphia at a very young age go on to develop eating disorders, but it doesn't mean if you have body dysmorphia that you have an eating disorder.
Okay. And one of our participants just gave us another resource, the National Alliance for Eating Disorders. Excellent resource. They have local and online food support groups. They can also give you therapists that specialize in eating disorders in your local area. All the resources that Kim showed during the webinar, I will put them in a follow-up email for everyone tomorrow so that you all have them. Okay, the next question is, what about emotional and stress eating?
So emotional and stress eating are not alone in eating disorder. Like I said, eating disorders are more complicated than that, and it's not to take away from how distressing emotional eating can be. I'm not trying to take away from that, but keep in mind, if you have an eating disorder, it disrupts your quality of life. Like and this really applies to any mental health condition, because you can feel anxious, but you don't necessarily have like an anxiety disorder. So you can have stress and emotional eating, but if it's disrupting your life, like you're not able to do things because you're choosing to eat instead of going outside and playing with your kids, then we start to get concerned. But honestly, a little emotional and stress eating is quite normal. Unfortunately for some, I guess I should say, but it's just part of being human. But if it gets into where it's impacting what you're doing, your quality of life, then we get concerned that it's a eating disorder.
Okay. Is comfort eating a part of an eating disorder?
No, that's separate. Like I said, with eating disorders, it tends to cause extreme distress. Like what they are doing is not necessarily comforting. Like they are stressed, and then they do that, and it makes them feel better. But it's not, having a comfort food meal like in the Midwest. I'm thinking like meat and potatoes. That's a big thing in Minnesota. But things like that is not the same as an eating disorder. But good question.
Okay. This next one says, I've heard from professionals before that one type of disordered eating is to force the brain to release certain chemicals versus a second type of eating disorder and the objectives of that. Are you familiar with dialogue like this, and can you explain it more?
So I'm not sure I understand. I haven't heard it described as you're describing it, so I apologize. But eating disorders and really any mental health disorder, it involves your neurotransmitters, which are basically the things that tell your body what to do. Like because I'm moving my hand, something went to my brain and told me to move my hand in literal seconds. So the same thing happens in eating disorders, and it's usually off balance. So there's a lot of things that go into that, and without becoming too nerdy and putting people to sleep, just know that there are chemicals involved in eating disorders, and food causes certain things to be released, and that's why certain food can be comforting. It doesn't have to be an eating disorder. That's why chocolate sometimes just makes you feel good and things like that. There's a lot of things that play in your body. So I don't know about that specific kind of line of thinking that you're talking about, but I do know there's chemical aspects behind disorders and just food in general.
Okay. How might you handle a parent who's completely focused on diet when the doctor is recommending a specific diet for an adolescent?
I am not sure I understand that. Is the parent on, well, I don't understand if the parent's on the diet or the child is on the diet. I'm not sure which, the child is on the diet.
Okay, the child is on the diet, yeah.
Well, in that case, I mean, if a doctor is recommending it, then I'm usually, if that's the case, it's typically with like epilepsy is the one that comes to mind for me. And in that case, you can just have the conversation about, and this is how I like to describe food to kids. I don't have any children myself, but this is how I always talk about it with my niece and nephew is your body is like a vehicle, right? There's some bodies that need diesel, or some cars need diesel, and others need, E85 or whatever the gas is. And your particular child in this case just needs this specific diet in order for them to function appropriately. And that's okay. That's just how their body is. So that's how I would approach it. And especially if it's related to epilepsy, their body just will like that better. Like they will do better on that diet.
Okay.
And sorry,
someone,
Patty, she put in there that the parent is mostly concerned with their weight.
Their weight.
That's that is I do not agree with that. That sounds like problematic to me, but again, every parent can do that's their kid, so they can parent how they want. But that's a hard situation. I do not have a good explanation for that. I'm sorry for whoever was putting that in there.
Okay. Somebody asked, what about replacement eating? Like because of pain, you have pain in your body, you eat.
So that to me is more along the lines of emotional eating. However, in that circumstance, it can also be binge eating, depending on how much you are eating. Are you eating to numb yourself? Then that sometimes can lean more on the binge eating disorder. Now, normal people can binge. Like people can binge and not have a binge eating disorder, just like you can restrict your food and not have anorexia. So I would just take a look maybe at binge eating disorder or have this conversation with your doctor. But sometimes with pain in particular, it can be more emotional eating because you're experiencing something extreme pain and the food makes you feel better sometimes. So it can flirt with an eating disorder, but it really will depend on your specific case.
Okay. Someone just put in, should I be concerned? I feel like a loved one cannot stop grazing, no matter if they just ate a full meal. If there's food readily available, they can't seem to stop themselves. How can I let them know I'm concerned?
So some people just are snackers or grazers, you know, some people do their own thing. I'm a big snacker, but I guess I'd be curious, why are you concerned? Is that behavior causing them to have medical issues and things like that? So in that particular situation, if let's say the person is morbidly obese or really overweight, then, you know, there's a concern, but at the same time, that's between them and their doctor. So you can always bring up your concerns, but in that particular situation, I don't have enough information to understand necessarily, I guess, why you're concerned, but yeah.
Okay. Does anyone else have a question? Because as of right now, we've answered everything that's good. Okay.
Spoke too soon.
More questions. Spoke too soon. Okay. Okay. So someone wrote that they are a longtime sufferer of bulimia, hid it from my doctors for years until I hit a breaking point and was afraid treatment wouldn't be covered by insurance because I didn't disclose. I've come clean with my doctor, but still need additional help to deal with the endorphin addictions of food, which I will reach out for. Just wanted to let you know that the fear of discovery extends well past teenage and college years. This is something the community and insurance carriers could help dissuade. It's a wonderful comment there.
Yeah, and I feel like for the person that made that comment, bulimia in particular is very misunderstood, because why would you eat something and then throw up or, you know, take laxatives to get rid of it? A lot of people misunderstand it, but just know to the person that wrote that you have or you had a mental health condition. Like you couldn't help it. So I appreciate your courage to share your story and opening up to your doctor. So good for you.
Okay. If food consumes most of your thoughts throughout the day, like what am I going to eat, what would you say to that?
That's talking about me. For those of you that maybe haven't met me or interacted with me or listened to me before, I am a massive runner, so I am always thinking about food. It depends on why you're thinking about food, okay? So if you are thinking about lunch because you know that it will make you feel better because you're just so stressed, that's different than saying, I just really enjoy food and I'm looking forward to the meal that I planned and have prepped for supper. So it's really going to depend on how you're feeling about the food. But as a runner, I am always thinking about my next meal just because I need the food all the time. So it's all about your relationship with food and when you should be worried. But great point. I'm glad you brought that up.
Okay. All right. Does anyone else have any other questions? And while we wait to see if anything else comes in, we do have a short evaluation, or you could use the QR code with your smartphone, and a few more came in. If you overeat and then beat yourself up mentally repeatedly, is that a disorder?
Well, without knowing more than that, it can. But again, where is that guilt stemming from? Why are you overeating? Are you overeating because you've been trying to lose weight and you aren't eating enough calories for your body to function day to day, and then you eat because you need food? Or is it because you're having an extremely stressful day and all you can think about is just devouring the food and being by yourself, and that will help you feel less anxious? So yes and no. It could be a piece,
Okay.
but it doesn't mean it is a disorder.
Okay. Do you see an increase in eating disorders for those that have had weight loss surgery?
So specifically related to weight loss surgery, I do not have a statistic for you, so I can't comment on that. But just given having a history of dieting and things like that, that just puts people at higher risk of eating disorders. So I have seen people develop eating disorders after having like a gastric bypass or something like that, because in order to continue losing weight excessively and not in a healthy way.
Okay. Okay. And we got another question about, is emotional eating a disorder? You did talk about that earlier, but maybe they missed that. Do you want to talk about that again?
The emotional eating one, sorry.
Mm-hmm. Yes.
Yeah, so emotional eating is not a disorder. That is not a diagnosable mental health condition. It can be a piece of any of those disorders I talked about. And if you have emotional eating, it can later on make you higher risk for having an eating disorder, specifically binge eating disorder, but it's not a disorder in and of itself.
Okay. Okay. So anyway, thank you everyone for joining us today. Tomorrow I will get all the resources that Kim mentioned during the webinar, plus the additional one that one of our participants gave us, along with the handouts. If you would take a moment and fill out the survey or point your phone to the QR code, that would be wonderful. We do have some upcoming webinars. We've got one with our Sanitas partner on the 26th. That's on depression. And then next month, Dr. Nick Dewan will talk about mental health care disparities. So Kim, thank you so much for all the information you gave us today. It was very, very informative. And I want to thank everyone for joining us and hope you all have a wonderful rest of your day.
See you, everyone.